Welcome to the Beverly Hills Plastic Surgery Podcast, episode 250. I am here with the ultimate co-host, Dr. Millicent Rovelo. How are you?
Woo! I'm really good. I'm really good. Thank you so much.
I am very happy
to be here.
I know. Can you believe it? 250 episodes?
250. We are quarter of our way to 1,000. We are making big strides.
That's a lot. That's a lot of podcasts.
By the way, that's a lot. Just FYI. That's 5 years worth of podcasts right there, doing them pretty much every week. So it is a big milestone.
You know what I'm most proud of? Is that you continue to show up here to do these with me, because at some point I thought maybe I'd lose a tooth or, get kicked in the nuts or something like that. I don't know, but you've been pretty good about that.
We still have another 5 years to go. Don't.
So at least I'm good with it.
So far, so good.
Punch in the stomach. But no, there's been no violence, and you keep showing up here. It's great.
I have. I love it. I love doing this with you, and it's been a lot of fun.
Yes.
And we are nowhere near done, and we've nowhere near exhausted all the things that we can talk about. But today, we have a special treat, courtesy of our amazing producer, one Sean Gosser. The folks who are listening in their cars can't see what we have here. But this is a spin the wheel of the podcast.
That's right. It's a topics wheel.
Yes, in case you've never heard of that. It's a spin. It's like a Wheel of Fortune wheel.
I'll give you a little sound for those of you listening.
Do 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 do. And
look
each
at that.
place the wheel lands has a topic on it. And these are the top topics of the past year. So any topic it lands on, we're just going to do a quick 2-minute review of what we talked about. And if it piques your interest or you want to go back and revisit, there's a whole podcast where that comes from.
That's right. You can go back and listen to these are previous podcasts, but we're going to kind of hit the topics and let's get started. Let's do it. All right. So here's the first official spin.
I'm so excited.
That was a little tester.
Breast implant choices.
Oh, that's a good one. I liked this episode a lot.
Yes, this one was very scientific and it had a lot of big words and we talked about a lot of things. But this was about how in the world do you choose the implant that's right for you when there is a plethora of choices out there and a Google rabbit hole that you can go down when you start doing your own, air quote, research. So this is about the sizes. It's about the profiles, how high they project off the chest. It's about the contents of the implant, saline, silicone, the cohesiveness of the silicone. It's about all these things related really to the science of the device.
Yeah, and it's about how we as surgeons guide our patients to the right device, because again, the patient will have some idea of what they want as the result, but they won't necessarily have the knowledge of the devices that we do. We have a lot of knowledge.
So much.
Of, not only from putting the devices in, but from taking them out, see how they do over time. So, having a little gray hair definitely helps. I mean, I know that you may have some. We would never know in 100 years.
Never know.
Never, and we never will. And that's the beauty of the beauty industry. And but that is the key, is you want to know what device is going to work best for you.
Yeah, and it is really, this is where you do have to give your plastic surgeon a little bit of trust because you can tell them what you want, you can tell them the look you want, but they have put these implants in many, many, many times. They've used different brands, they've used different styles, and so they will know what works for your goals.
Next spin.
Do it. Mommy makeover.
Oh, this is your bag.
This is me, because I'm a mommy that does makeovers. I mean, how cheesy, right? But this is just...
I am not a mommy.
You're not a mommy, but you're a daddy.
I'm a daddy.
You're a daddy. So this is, at its most basic, a mommy makeover. And we go through what exactly that entails, because it can be anything. There's no set recipe for what a mommy makeover is. Generally, it has something to do with breasts and abdomen, because those are the areas that those little suckers and parasites we call our children like to destroy. God bless them.
That's good.
So those are the areas that are typically addressed. But it can be anything. It can just be liposuction. It can be some skin tightening procedures. It can be a labiaplasty. It's whatever that mommy needs after ideally finishing her childbearing course.
Yeah, and it's whatever combination of, breast surgery and abdominal surgery, whether it's lipo, abdominoplasty, whatever's going to bring your body back to where you want it and to look great. And there's a lot of options. I highly recommend that the mommies go listen to this podcast. That was a really good one.
That was a good one.
These, by the way, Sean picked these because they were our top downloaded episodes, and so these are all really highly
high impact ones.
Yeah, I think so.
And I think the crucial thing that we made a point of on that one is that despite its cutesy little name, it's not a cutesy little surgery.
Hardly.
It's a big deal surgery. It is a big commitment. You're going to definitely need some help at home. You're going to need someone to help take care of you. It's going to be a longer recovery than maybe you're expecting, and it's going to cost a lot of money. So those are the take-homes of the Mommy Makeover.
All right, that was 2 minutes. We're moving on.
Still going. Ooh, this is you. Deep plane facelift.
Yeah, this episode was really key. I mean, we have a lot of episodes about facelifts.
Yeah, you tried to do an episode today, and I shut it down.
I know, but that's because I really am doing a lot of facelifts, and I think that the people listening to this podcast want to hear about what they're having done. And so my patients are coming in for facelifts because I am now in the facelift set myself. I am ready.
The echelons.
Deep plane facelift. This is the technique that I use most commonly to do primary facelifts. My revision facelifts, totally different animal. Right. If I can do a deep plane on a revision, I will. If they've had a plication facelift, which is where the SMAS, the fascia under the skin, the thick coating of connective tissue over the muscles, is plicated, where you sew it to itself. I tend to like to make an incision, go under that fascial layer, and lift it to get a really effective, very beautiful contour to the face. In the neck, I tend to use the platysma muscle, which is the continuation of the SMAS into the neck. And this episode goes through all that. If those were big words that you're going,
those are really big words,
then you need to go listen to that episode. If I'm doing your facelift, if you're getting a facelift done somewhere else, not everybody needs a deep plane facelift, but it is a really nice technique. It wasn't invented in the last 10 years, despite what many of the surgeons on the internet say right now. There was a book from Tord Skoog from 1971 talking about the deep plane facelift. So if anybody invented it, it wasn't being done by the guys just in the last 10 years who all claim responsibility for inventing this operation.
Right. It's a very powerful technique, but it's just a technique. And there are lots of ways to address it. It's talking about how the deeper tissues of the face are addressed to accomplish what we all want, which is a natural, beautiful lift. So that is the deep plane facelift.
Moving on. I feel like I should do like a sprockets. I don't know. Did you ever see Sprockets on SNL?
No.
When Mike Myers plays like this German guy called Dieter, and he has a talk show. And at one point, if somebody's babbling on, he goes, "Stop! Your story has become tiresome. Now is the time on Sprockets when we dance."
Why am I just now learning this phrase? Could have been using it for 5 years.
So there you go. Anyway, we're on to...
Back to you. Revision rhinoplasty.
What's that?
You do a few of these, right?
Revision rhinoplasty? What?
Yeah.
Oh, yeah, that's right. It's something I do like all the time.
Yes.
Revision rhinoplasty, different than primary, a different operation than if you're having your first rhinoplasty. Oh, yeah. It is completely different because you've already had rhinoplasty and you're trying to correct it. If you're having a revision rhinoplasty or considering one, go listen to these episodes or watch them on YouTube. I don't know how many people watch our YouTube channel versus listen, but I know a lot of people do come in and say, "Oh, I saw your recent podcast." So I think you do it either way. But listening, I listen because I'm in the car. That's kind of when I review our episodes, and I got to say they're pretty cool.
This one's a good one though. It really does. If you are at all thinking about a revision rhinoplasty, I think this is a must listen because your
The issues are
experience in a revision rhinoplasty is going to be not night and day, but definitely different than your first go around with a primary rhinoplasty. And so you need to sort of know that and be prepared for it going into your revision.
Interesting. A lot of patients will think because it's a revision that it's going to be simple, it's going to be less money, it's easier because like they've already had a rhinoplasty and they spent the big money and now they don't like it, so they need it fixed. And they'll come in actually thinking that it's easier.
Yeah.
None of those things are true.
Nope. Sorry.
So go listen. If you have questions, review those and send me a DM. All right, ready?
Ready. Do it.
Oh, wait, I got to go counterclockwise, right?
Yes.
That was what I said.
This is the natural lift.
It's the same thing.
It's the same thing as the deep plane lift.
The natural lift was when we made fun of me for naming the face.
That's right.
Right, because I
No. I'm gonna say this one.
Here we go.
You
This
just
is where
sit
it
back and
happens.
take it. So there's this whole thing, right, where like people name their procedures, and it's a marketing ploy because people then think that you're doing something new and cool and that you yourself can only do because you've trademarked and named it. When in reality, you're probably doing the exact same thing or a tweaked version of what many other plastic surgeons are already doing. You've just happened to give it a cool, fancy name. And you were getting a little bit bent out of shape that people were coming to you and asking why you don't have a named lift. So you said, you know what? Screw it. I'm naming my facelift. It's the natural lift. And we did a whole podcast about how beautiful it is because it really is. It really is a natural lift. It's what you do. It looks fantastic. You just had to give it a name.
I couldn't take it. No. You know what happened was my patient who I'd done every other operation in the book on, went somewhere else because they had a named procedure. And when she was completely dissatisfied with it and literally disfigured by it, she came to me and I said, I don't understand. We were set up to do your facelift. How did you go to this other surgeon to get it done? And she threw it back in my face and said, you don't do the blah 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 lift. Like you're incompetent,
yeah.
And you're unable to do that lift. And in reality, what I do, I think, is so much better. I don't make incisions on the face. I don't do any of that stuff. And I was just like, so I have to name my procedure so people will think like, well, I should go there because he does the natural lift. It was tongue in cheek, me making fun of myself, but I had to do it because I just don't know what else to do when people fall for these marketing ploys. It's right up there with the photoshopped before and afters. I'm not going to go on a rant. I know. Stop! Your story has become tiresome. Now we'll spin again. Got it. All right, here we go. I know you were going to say it, so I did it for you. You did that one. Go to the next one. What next one?
Nope, we can't do that one either. So it landed on, teaser alert, top trends in 2024. We are going to do a whole podcast on this next week. So let's just move on to another topic.
We will cover the top trends next week, and we'll do it with champagne since we didn't realize we were doing the 250th episode
I know,
today. So.
And they tried to give us white wine, which is just like, ugh.
We can't do that.
No.
I'm sorry. I can do champagne. I can't do white
totally
wine.
do champagne. I cannot do
We
white
did
wine.
deep plane. What else? What are we missing?
Let's see. What are we missing? How to pick your plastic surgeon.
Ooh, this was a good episode. Everybody should listen to this episode. This is a good one.
Yeah. We went through like, how do you pick it?
It's simple. You either pick Dr. Rovelo or Dr. Calvert, and after that, nobody else.
Yeah, I don't know why. You
that is not true.
Don't have to listen to the whole podcast. That's pretty much the cheat
right. We can just finish it right there, and that's good. No, that is not the truth.
That's literally not. That's not what we talk about.
There are 200,000 rhinoplasties a year in the United States. I do roughly 150 of them.
Yeah.
Somebody's doing that other
doing the rest. And
199. It's
doing
a lot.
A great job,
and they're doing great.
So there are a couple different ways you can go about finding your plastic surgeon. If you are a complete novice to the field, you will probably start by doing a Google search if you're of my vintage, or a social media search, or something where you spit it out there. Plastic surgeon Beverly Hills, plastic surgeon Seattle, plastic surgeon whatever. And you're going to find a list of people. Or if you're sort of in the world or you know people that have had plastic surgery, you may go to them directly as a source and be like, oh, who do you recommend? Or who do you recommend? But at some point, you're going to find a way to compile a list of potential plastic surgeons. And then once you have that list, this kind of goes through how do you choose amongst all these people that you've been referred to or that you found. And I think we came back again and again to the befores and afters. Do you like the work that they have on their website? Not necessarily their social media, because that can be super marketed. I don't care if you do a TikTok dance. Like, how good are you as a surgeon? And that comes down to your befores and afters.
I do know TikTok dances.
I do know. I think I'd be pretty good at TikTok dances, but I don't do them.
You were a musical theater kid.
Right?
Yeah, you probably would be good. But you know what? That doesn't mean you're a good surgeon.
Doesn't mean I'm a good surgeon. No. So that's not how to pick your plastic surgeon. No. So this episode just kind of dives into how to parse out the social media fluff and the marketing fluff and the named surgery fluff and really hone in on what's important when you're looking for a plastic surgeon. Their training, their certification, their befores and afters. And ultimately, once you do kind of come down to one or two people, how you get along with them, how you like them, how you like their office. Is this someone that you can get into literally a long-term relationship with? Sustained for at least, a year. You kind of go through a lot with your plastic surgeon.
100%. And I will mention a few sources. There's the Aesthetic Society website. Mm-hmm. There's plasticsurgery.org. There's the rhinoplasty.society.org.
Yep.
There's the Newsweek rankings, which I think probably are helpful.
Yeah.
But I found at some point we're going to go back to a glitch in the matrix with that. Not today, but I want to talk a little bit more about the statistical analysis there.
Oh, okay.
So there's more to that story.
More to come.
Exactly. And also, I think the other thing is your Google searches are important, but you need to realize that a lot of those are paid searches, and a lot of the SEO stuff can be tweaked.
It's pay to play.
Yeah, it is. It's pay to play. So get a referral. Find out somebody who's had surgery with that surgeon. A lot of my patients, if they'll come in and say, like, can I talk to some of your patients? I'm like, absolutely. Sure. And then we have, we'll call a patient and say, hey, so-and-so is a new patient. They want to hear your experience. And then we let them go.
Yeah.
The reviews are difficult, too, because, our Google reviews and Yelp reviews, great. I mean, if you can tell which one's written
by an actual patient,
good on you.
And it's hard.
It's hard for me to tell.
It's hard, and the medical field is different because as physicians, we're not allowed to necessarily respond because it's HIPAA violations, and patients come with so many different issues and concerns that it would take being an actual doctor to be able to understand why maybe someone had a complication versus someone else. So yeah, reviews are tricky. Listen to the podcast. It'll tell you all about it.
There you go. Next one. What else do we have?
What else do we have? Oh, look at that. It landed on big ass body lift.
Oh, yeah. That's
me.
I'm gonna hide under the table for this one because I don't do these anymore. This is all you. Somebody comes in and says, I need all this stuff taken off.
That's me.
Dr. Rovelo is your girl.
These are patients who kind of come into two categories. They can be big ass body lifts in the sense that they've lost a ton of weight. Their skin has skin. It's coming off of them. There's just so much extra skin that needs to be lifted and cut off and redraped so that you can see that, skinny person underneath all of that skin. And those are big surgeries. They're long surgeries. They take pretty extensive recoveries. There's a lot of physiological things you have to take into consideration when you're removing that much skin. So this goes into how, complex that can be and what to expect. And then I think we also touch on big ass body lifts, people that are just large, but they also need plastic surgery. So this goes into how we manage the larger patients and what that entails and what a recovery for that looks like as well.
Great episode. If you're thinking about a big ass body lift, do listen to it and go see Dr. Rovelo. And I'm going to cheer her on from the stands. Do we have anything else? What else do we have?
I think there's one. Let's see. Breast implant placement.
We just covered that in our Breast 101. But that's okay. Breast Implant 101, which is our last episode, we covered this. But this is whether you put the implant under the muscle, over the muscle, under the fascia, or just under the gland. This is about the pocket creation to give you the best look. And again, this is where the experience of your surgeon and understanding what you want and what device is going to be used really comes into play.
Yes, because the implant placement, it goes hand in hand with the type of implant you're using, as well as the individual anatomy that the patient comes with and their individual aesthetic goals. It's not like a one size or one placement fits all. So this is kind of similar to the breast implant choices one. There's a lot of experience that goes into knowing what works best for any given person. But that is, it's important. People want to know where their implant's going to go. What else? Did we get everything?
I think we got them all, didn't we?
I think we got them all. The only thing we didn't talk about were the top trends, but that's coming. Stay tuned.
Wow. That's pretty good. I like this wheel.
I really like the wheel.
Maybe what we should do on a future episode is like I'll fill out like topics and then we'll spin it. Like we'll use this again. This is not the last time you'll see the wheel.
This is going to come back.
This is a good thing.
I have plans for this wheel.
Good. Cool. Well, anyway, I think that's it. That's our 250th episode of the Beverly Hills Plastic Surgery Podcast. I am very, very excited for the future for this podcast. I would love to do more in terms of bringing on more guests, and I think we have some plans for our fellows coming up. Like I think there's just a lot we can do to help people get the information that they need to have the best possible plastic surgery experience that they can.
That's why we're here. Well,
in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.